Welcome back to another episode of Behind the Red Line. I'm your co host, Alessandra Nicholson,
And
and
I'm
this.
Rebecca Peplow.
Welcome back.
Good to be back, but not under these circumstances.
Not under these circumstances. I'm having trouble like not chuckling, and I think I definitely want to talk about that as far as like stress management. But this is a day.
Yeah, it was not something pleasant to wake up to, that's for sure. It's
Absolutely
like,
not.
for me personally, I haven't been rocked by the news this severely since I was watching 9/11. And that's, you know, there's been so much bad stuff that happens in between, not trying to downplay any of that.
No,
But for me personally, feeling those feelings. Uh,
absolutely. I can definitely relate to that sentiment around a few things that have happened, over the years, and it's almost scary how apathetic I'm becoming just to the hit of it. But before we get too involved, I do want to welcome y'all back to another episode of Behind the Red Line, a podcast designed to illuminate maneuvering a broken healthcare system as a patient and provider. Restricted access does not have to mean restricted resources unless you are an American citizen today. This is a new audiovisual podcast that's brought to you on YouTube, as well as LinkedIn, Facebook, and other platforms. And then one of the things that we usually always say is that we want to explore practical tools for radical accountability, respect, and healing at the intersections of health, wealth, race, class, and gender. But obviously, this impromptu episode is going to fly in the face of a little bit of that because part of what we wanted to just offer today was a safe space to talk about how much this impacts you, how you're feeling about what's going on. So, yeah, and we'll of course offer the resources that we can, as this is late breaking news for everybody this morning. Like you said, we woke up to this. I keep saying landmark because I don't know what else to say. But woke up to this landmark historical decision to overturn Roe v. Wade.
it's is it a landmark? It's a
Hey,
monumental decision.
monumental.
Every landmarks have a positive connotation for me, and
Do look, do they?
yeah, let's reflect on that.
Let's reflect on the language because the language matters, right?
Language matters.
It's a monumental decision in the essence that it has an impact that is beyond far reaching, right? It's going to have impact in the individual states and counties and towns that comprise us, but there's also impact that will be felt in other countries, due to the fact that America is a global leader in certain fashions. And abortion and healthcare care is already a contentious issue in many other countries. So it's just not the way that not the thing you want to be looked up to for today.
No.
I'm not feeling proud
So
today.
a lot of us that are in the healthcare profession right now, I don't know about you guys, but I walked into work today and I couldn't be present. Um, I walked into work and you could see it in the hallways, um, almost in every woman's and man's face. And it was crazy because I go into my office and everyone that would walk in be like, "How you doing?" And then they just unload on
Yeah.
their feelings. Um,
Yeah.
Everybody was impacted by this today.
Especially for the healthcare workers because while this has a major impact for the individual citizens, we have the dual impact that this is going to impact us as employees, as people seeking care, and also as people providing care. So it's a trifecta of stress that some of us woke up to this morning. One of our listeners, Leslie Cronstead, thank you for jumping over on the Process Network. She said, "Girls, I was crying this morning. It was devastating." Yeah. I think I was talking to one of my friends about this. I think the only reason why I haven't broken out into just flat out tears is because, like what you were saying, like it's just been so much stuff lately from all different sides, still, coming from We just had the shooting in Buffalo, the racially motivated terrorist attacks that have been taking place. We've seen weeks and weeks of protesting at the Capitol in anticipation of what's another word for it? Shocking,
Yeah,
shocking revelation by the Supreme Court this morning
right. And could you imagine if the document didn't get leaked in May? So
that they were
the
just gonna
draft,
slap us over the face with this. Yeah,
yeah.
I
So
do think that just because of word of mouth, people would have eventually found out that something was up. But yeah, I agree. How much more devastating would this have been to be blindsided with this ruling today?
so that's going to put a whole, we just had the case with Redonda Vaught, the nurse that a few years back made a medical error and ended up causing the death of um, of a patient.
Hmm.
And um, now the nursing community was rocked by that
Yes.
because, and now here on the flip side, you're going to have the medical community feel so torn because they want to be able to provide patients with the best health care they can. So now we're going to have patients in our facilities that their bodies cannot tolerate a pregnancy. Their bodies and their lives are at risk for carrying a pregnancy, or their bodies are at risk of losing that child
Right. So many
because of,
options, so many
right? So
paths.
now everybody else's lives are at risk, including a baby if the mother can't sustain a pregnancy. So your healthcare professionals are put in this stance of like, well, what are we going to do now?
Right.
Am I going to stand there and put my patient's life on the line because I know they can't carry a baby to full term? Um,
Absolutely.
it, it's not like, oh, I'm just going to incubate my creature for 9 months. It's your body goes through hell.
You know, I just finished an episode of The Process, Hot Topics with Denard, and one of the things we discussed was there being a privacy concern now about menstrual tracking apps
Yeah.
and whether or not that privacy is going to be violated because folks may or may not know. You may want to do your research that Roe v. Wade also impacted HIPAA as well, as far as putting in some provisions as far as patient health information being protected. So there's going to be some states that are going to want to go one way versus the other with that. And the question was, is me using this app setting myself up, to be prosecuted with this data being asked about? And Denard was shocked as a man that an app such as that even existed. He said, why would you have that? Right. So we
Well,
talked
and
about it, and to me, it goes along what you're saying. Like, so many people don't even understand that being pregnant is not just some walk in the park where you just carry a child and it just grows and there's no potential for complication or health exasperation that can take place. That's just not true. So
um,
it's a
I'd like
huge
to
deal.
back up a second.
Mm.
So when Roe v. Wade was first put into place, you mentioned the HIPAA protections. Can you unpack that a little bit? Because I don't know what
All
HIPAA
right.
protections came through that.
So let's see. Because Denard and I also were looking at this, and especially because everything with this is so late breaking, we were literally reading the news as we were looking at it. So let me take a look at what they're talking about here.
Yeah.
So one of the articles I have up about this is how this is going to impact employer benefit plans. I definitely want to get into that. One of the articles I have up is how this is going to impact the psychological crisis that we're already suffering here. How this is disproportionately affecting Black women, and then
Yes,
lastly, of
absolutely.
course, how this is going to impact privacy data. All right, so Hipaa background. One of the things this article, let me drop the link for you guys real quick so you have it as well, because y'all know we about our research over here on the Process Network. We won't be playing too much about that. Oh, hold on, I didn't copy properly. Oh, let's get that going. There we go. All right. So, one of the things that this article is discussing in regards to HIPAA was that the Health Insurance Portability and Accountability Act, which we all refer to as HIPAA, and the federal healthcare privacy law that governs the disclosure of protected health information, referred to here as PHI, and it generally restricts the disclosure of absent patient consent. So it also goes on to say generally HIPAA preempts contradictory state laws because part of the issue here is that with abortion not being federally regulated, each individual state will have the opportunity and the option to create their own abortion statutes, whether that be allowing it and what that looks like, what providers have to do, versus disallowing it or putting different restrictions such as time limits like the 6 week abortion plan or Mississippi's 15-week abortion plan. So with there now being an extreme complication in what states are requiring what, that information that we love to talk about being passed on those electronic healthcare systems, tracking systems becomes really difficult. So it says, however, HIPAA does not preempt state law that's are more stringent than HIPAA. In other words, it provides a greater privacy protection for individuals who are subject to PHI. So if you're in a state that has a privacy law that is more restrictive than HIPAA, this is going to become an issue for you because HIPAA is not it's not going to be the baseline for you anymore. If you have a state that's looking to do things like access your PHI information, they now have the green light to create rules and regulations around that. So it says one may reasonably think that prosecutors and law enforcement would be prevented from accessing PHI, such as those relating to an individual obtaining an abortion or related reproductive health service. However, while HIPAA generally prohibits the disclosure of PHI without the consent of the patient, there are several exemptions. Notably, a covered entity may be compelled to share PHI for law enforcement purposes as required by law or in
Hmm.
response to a judiciary or administrative proceeding, i.e., a court order, subpoena, discovery request, or a summons. All right. And then the last thing they add here is just to note that HIPAA does require covered entities to only disclose the minimum necessary information to fulfill such a request. So that could mean that could look like a hospital turning over infection data to your DPH, but they restrict your name, your birth date, your home address, things of that nature. So
Mhm.
it could be that a request gets made and then they have to fulfill it, but that some of your personal information may or may not be included.
Right.
It makes me nervous.
A little bit.
It makes me nervous. Another big concern that I saw, and this article was posted by the AAMC, that they're a little bit worried now about being able to get an influx of new OBGYNs, as there's potentially 26 some odd states that will either be banning abortions or restricting abortions, and therefore residents may be unlikely to seek residency in those states.
And that's huge because
Huge.
women need that, you know. We need our OBGYN doctors.
Right. For much more than even just abortion care. It was part of what made Denard's question to me, made me laugh a little bit, was just people just don't really understand the breadth of care that's provided by these facilities and what people are not going to have access to. So it's definitely scary times.
Yeah. And it begs the question too, like, will this open up? In the back of my head this morning when I was trying to unpack it, I'm like, is would a benefit to the situation allow more men? In the back of my head, I'm trying to unpack this, right? So I'm like, in the benefit, is there a silver lining? Will this open up the door for more funding to be sent to some of these facilities like Planned Parenthood and other to help fund low cost or free vasectomies for men? I mean, the cards are flipped now, right?
Are
Uh,
they? Are the
I don't know,
cards
man.
flipped?
I
Or
just
are women just going to be unduly burdened further to suffer the brunt of this healthcare and financial blow? One of the articles that I was reading talked about how this is going to disproportionately affect women of color.
absolutely.
And this is a LA Times article, and they're specifically talking about for Black Americans that are more likely to live in the southern states where this is more likely to be an issue. It says that Some of the most restrictive states, like Mississippi, already have bans after 15 weeks. 74% of the women seeking abortion are black. Meanwhile, in Alabama, which made it a felony for doctors to perform abortions at any stage of pregnancy, black women account for 62% of those that are looking to receive abortions.
Yeah.
And then just the financial impact of the fact that if they want them, they will then have to travel out to states. So they're talking about women in Louisiana and Arkansas will likely have to travel hundreds of miles to get to Kansas or Illinois in order to receive that care. And then the most important part to this for me, because I grew up in a single mother household, and my mother's sisters were also single mothers, and they talk about considering the fact that nearly 70% of black women are their family's breadwinners compared to just 36% of white women, right? So it's not even just the woman that is going to be impacted by this. If black women or women of color are not able to provide for their households, their entire homes are impacted.
And I don't want to get the statistic wrong, but I believe it's black women are, what is it, 3 times more likely to have a negative outcome when it comes to OBGYN outcomes in the hospital settings, or
Oh
is it
yeah.
just in general?
I
Um,
don't yeah, I don't know the statistic, but I know that they're both high. Both of those numbers are high as far as
and
black women
it's
having
disproportionate.
disproportionate poor outcomes for healthcare, surgery, mental health services, maternity health services, and beyond.
Well, not 3%, three times more
It's
than,
terrible.
people not of color.
It's
Um,
just absolutely gut
so it just
wrenching.
makes you think, like, and I think reading today, um, black women are more statistically, like, are getting abortions more, but that doesn't disclose the reasons why.
The reasons why.
It's not the people, the percentage of humans that use these abortions as birth control is so just, it's so low, and I think that it's
And to
been put
me,
out on this
irrelevant,
platter.
especially now, especially working in surgery. I know I definitely have a different opinion, I guess you could say, as far as who should be accessing surgery and when, because I personally feel like surgery is a lot more serious than we take it here in this country and should be a last resort more often than it's not here. And so, it's like we're already struggling to do basic surgery with the staff that we have, with the equipment that we have, and now we're asking to do more with less. So like you said, maybe it translates into funding being moved around to different places, but that's a mad dash, and usually
It
money
is a
that you
mad
have
dash.
to, right, you have to apply for. You have to have those teams there that are looking to do that work, and it's just mind-boggling to me that in 2022, this is a conversation that we're having,
And also,
especially
like,
in the
you
healthcare space.
you brought up a good point with the data of, like, potential lessening of OBGYN physicians, because they're not going to be able to do their externships and whatnot, or practice wherever. So now you're going to have an influx of high risk pregnancies.
Yep.
So who's going to manage that?
Who's going to manage that? The teams that are already strapped. I've been in, I struggle with the not name dropping, but I've been in top 100 hospitals that don't have sufficient and safe maternity care, especially when we're talking about emergency care.
Yes.
From a sterile processing perspective, we talked about it on the process that a lot of times OBGYN, there's the C-section trays or circumcision trays, they're not well kept. Those departments are not well staffed. Those scrub techs are not well trained. Some of those departments don't even have anesthesia that is dedicated to their space. So if I have an influx of women that need emergency care in that way, are these hospitals even ready to receive them when most of our surgical services is geared toward the thing that makes money? Orthopedics, spine, heart. Unless they're specializing in OBGYN, it's usually an afterthought. So that
Yeah.
frightens me.
And the units, like the neonatal units, a lot of the time in these hospitals are so strapped as well. But do many of these places have the equipment that's going to be necessary to take care of some of these
Mm,
babies now? You
yeah.
know what I mean? Like,
So many
from what I've seen,
questions.
I'm worried. And
So many
obviously we're
questions.
Yeah, we're all, it's at the beginning stages. We're all in the what ifs right now, but I can't help but, we can't help but go down that channel yet.
It's hard not to, right? To immediately
Right?
jump off the deep end. And that was definitely like when we all started texting this morning about going live, it was like, from a regulation and late breaking news perspective, we definitely want to do a hot topics episode. But from just creating a safe space to be like, what just happened here? We wanted to be able to bring Behind the Red Line on, because like I think about that intro, we're talking about the intersections and the resourcing, and we've talked about suicide, we've talked about burnout, we talked about being able to check your ego, we've talked about being able to support each other. And it's hard to I just think about it, even from operations. It's hard to think about how difficult this is going to be for everybody in different ways. Like physicians that are now having to scramble and figure out how they're going to provide care, or folks that are just already at their wits end, that this might be a final straw for them. Even just looking at it from that perspective of suicide. I'm looking at an article on msdc.org that says 16% of OBGYNs have contemplated or attempted suicide before. And this is an article that was produced in 2020. So we know that those statistics have gone up just with the way that COVID has affected mental health overall. So
Yeah.
it's just terrifying, to be in those positions.
You feel like you're in the healthcare position because you care for people and you want to help people, but
Yes.
now you have a huge service that is not going to be able to care for their patients the way
No.
that they need to
Not
be.
effectively. No.
And that reminds me of the veterinary field a little bit. And they
Oh yeah.
have one of the, I think they have the highest, veterinarians have one of the highest rates of suicide in all of the careers at this current time. But it makes you wonder, like, when you're not able to provide the care that you have trained to be doing because you're going to go to jail, like,
Yeah, it's just mind-boggling as a healthcare provider to be in a position. Like I think about times where we've had like natural disasters, or anything, we've had to close our doors, and there's just, I can't even find words to describe how sinking that is when you know there are people that need your help and you can't help them. So I just Denara gave a little shout out, a little moment of silence to everybody that's dealing with that, because it's just another level of stress. Even looking further at this article, they're talking about the reasons cited for their burnout. 57% cited bureaucratic tasks, 36% cited EHRs, so those electronic health systems that we were talking about. And then the last round of them, 35% cited compensation. So isolation, just so much that's going to be increased for them, right? Because if we're talking about different states having different regulations, that means that there's going to be more paperwork. That means there's going to be more time dedicated to figuring out what's needed, when, where, and why. And especially when you are trying to navigate and make sure that you don't get sued, you don't get fined, you don't get jailed for the care that you're providing.
and in a country where mental health professionals are so hard to come by,
Oh, already, right?
like, every therapist, counselor, psychiatrist that I've encountered have a huge, they all have wait lists.
Every care provider has wait list. So it's
Not
just
enough
like,
to handle the,
how is this working? How
yeah.
is this slated to work?
And
Not
so,
sure.
like, if I know there's a lot of maps being thrown out there on the news, you can see already. Um, check it out. There's a list of states that have laws already in place protecting it. Laws where it will stay legal. Laws that are working on provisions to help keep it um, accessible. But the maps that show states that will make it illegal, and as of today, there's already, I can't remember how many. I know Kentucky was one of them. I think Ohio. Don't quote me on Ohio.
Ohio's banning.
It's already
Um,
done.
yeah, it's done. I think it was Louisiana is
Yep.
done. Um, so yeah, there were several states that had trigger cases that went into effect as soon as this decision was made. So, I mean, we've talked about the fact that this was emotionally jarring for us this morning. We woke up to this news especially as women, watching the posts come through from our girlfriends. Seeing some of the different social media posts that came through is just like, come on. I even had plans to, because I'm out in Oakland right now, so I had plans to go into the city this evening. And one of my friends was like, "You might want to rethink that. The Roe v. Wade decision has been made, and you might not want to be outside tonight." So there's cities that are planning on organizing and marching peacefully.
Yep.
But I've lived in this city long enough to see them riot for causes that were equally concerning. So even from that perspective, it was like, dang, we can't even go out or try to decompress in that way because it may be that I can't get across the bridge, or maybe that I can't get onto the train to come home.
Yeah. And I was getting alerts on my phone for, down the street from my place of work today at like 5:30. There was one. There's going to be another one later tonight. All weekend, there's going to be stuff going on everywhere. Like it's going on everywhere right now as we
Everywhere.
speak. And it was funny because like somebody on the news was reporting like, yeah, they announced it on a Friday when people don't have to work on Saturday or Sunday, so they're expecting a huge influx of stuff happening over the weekend. Um, and I think, I mean, it's just a lot. If you think of the movement a couple of years back, um, oh man, I think this is when it first came up and it was headed towards the Supreme Court. There were all of these marches, and none of them were violent. You know what I mean?
Yeah,
Like, but there's massive amounts of humans like
yeah.
coming together for this
Which could
stuff.
just be stressful, right? So we have a few comments. I'll definitely thank you guys for tuning in with us. Jeffrey Wilkins, he says, "Hey ladies, good evening, great topic." Hey Jeff, we miss you. He says, "Just want to put out there this food for thought. Maybe this will be an opportunity for the broken healthcare system to be revitalized to where they really provide the care that should be free to each and every person. Just saying, free services don't have to deal with the bureaucracy of what's providing and what it's not, right?" Definitely, I hope so, Jeff. I hope it does become. I hope there's silver lining involved in this. We're definitely already seeing some states that are taking the lead, that have already, before the case got decided, have already tried to put provisions into place to provide better care. Um, the my only thing with that is, there's no such thing as truly free services, right? Somebody's paying for something. But to your point, maybe, and even Rebecca, what you said earlier, maybe we could see a reallocation of funds that go towards providing safe and equitable care. Scary stuff. Tiffany Darville. Hey. No, we're doing all right tonight. Look, I've been obsessed with trying to use a feelings chart lately. Have you ever done this before?
Oh, I have. But
Okay.
I feel like I have to make my own faces on the feelings chart a lot of the
Right, we
time.
might need new faces on the feelings chart. Um,
Can
but I
you
do.
explain what a feelings chart is to those
Yes,
that
I
don't
was
know?
just about to pull one up. So absolutely, I will. So just full transparency, this is something that my therapist would use with me quite often when I would have trouble describing how I was feeling about a particular anything. Um, so I don't know if you guys ever noticed, like a lot of times when we say hi, how are you? We say, I'm good, I'm okay. Or we start immediately talking about what we're doing rather than how we are feeling. So when they would challenge me, as far as okay, I that sounds great, work's great, school's great, life's great. How are you feeling? Right. So a feelings chart, and they look very juvenile, some of them, but they just have various faces up on them, that are emoting different emotions. So what I was able to do, and I'm gonna see if I can pull one up for you guys. I'm just like doing a quick little Google search. Um, what I was able to do was look at the chart and see if I could identify with some of the feelings. So let me see if that is even large enough for y'all to see. Hope you can see it. But on the feelings chart, and there's a bunch of different ones you can Google and find tons of them. It'll just list different faces with different emotions. So you can see here, like he gets confused, ecstatic, guilty, suspicious, lonely, anxious, right? So it just helps you develop your vocabulary about how you feel. And there were even some times where he would use a term that I felt like wasn't quite like maybe say, "Are you frustrated?" I'm not quite frustrated, but let me look at the feelings chart, and then maybe I can say, "Okay, I'm kind of exhausted with this situation," or
Yep.
whatever the case may be. So
Yeah.
there's that.
I had a
Okay, one
professor
second.
that would put those on her door,
Yeah,
so you knew, like, to her office, so you'd know how what mood she was in uh,
come on.
before
Like a
she
little flashcard, like here's what you're walking into.
yeah yeah
But no, but you guys might find those helpful. Especially like we were talking about earlier. Like for me, when I woke up this morning, I had a really hard time connecting with my emotions about how I felt. I was shocked and I was definitely disappointed. But beyond that, I had a hard time feeling anything outside of, well, what in the what is this?
yeah. Like, what else is gonna happen? You know what I mean? Is it that messed up to be like, what else can get put on our plates?
No,
This is a hitting us while we're down is,
an
incredible to me.
understatement,
An
Yeah,
understatement, for
understatement.
all of us in the health. I mean, especially those of us in the healthcare system.
Yeah.
We're still going to work every day, masking up, um,
Yeah.
conquering the pandemic, but
Doing our best.
it's different from outside the real world, and I think a lot of us are struggling right now still with that aspect. So now here we go, another hit to the healthcare system.
Another. I feel for y'all. I'm not in it right now. Partially to take that mental health break and avoid that burnout that we talk about. But yeah, I feel for y'all because especially as an administrator, that was one of the second thing that hit me was, "Ooh, wow, somebody's about to have a long day," because
Yeah.
there are going to be crisis meetings upon crisis meetings trying to navigate this. And some of the things that we can do, you talked about coming in and everybody's just kind of floored, right?
Yep.
So being able to take a couple extra minutes for that fact, we don't have to power through everything.
No.
You know, we can take a moment and say this is heavy, and we
And
just
we
want to
took a few minutes,
acknowledge.
and like I pulled up the news. We were watching some of the live streams together in my office. Like, as humans, we need to sit here and unpack these monumental events going on in the world. And you know
Oh,
what?
absolutely,
If it's going to help the team get through it, we need to sit there and process it together.
absolutely.
Let's talk about it in a uniform way. Obviously it's complicated because there's a lot of people that have different viewpoints on this. This is a hot
Absolutely.
topic,
Hot
um,
topic, right?
so we need to
But
be
what's
professional
not,
about it.
it is a hot topic. Different people feel different ways. We can't all assume that everybody is upset about what's happening today, right? Some people have fought long and hard for what they were able to accomplish today. But I think one thing that we all can hopefully have is some empathy and sympathy for each other, and the understanding that even if we don't agree, we are feeling a different type of way today, and especially from a patient safety standpoint. And I would say it all the time in my text. Y'all know I say it all the time. You gotta do two things: keep that patient safe, resource the staff so that they keep the patient safe. Part of that work today was resourcing them emotionally so that
Yep.
they could focus on their job.
Yeah.
All right. Leslie Cronstedt says, "Am I thinking correctly when I'm thinking that the Supreme Court overthrown a level of stability that will not be seen again? The abortion laws can be changed with every election, technically." I mean, technically, I don't think it's,
Technically.
over the top that no, this has thrown a monkey wrench into things. And to Jeff's point, hopefully it becomes an opportunity to provide some true stabilization that is not um, this vulnerable. But that is indeed what we saw today. There's going to be instability within insurance billing and payments, with between access and care providers, between all these backlashes like mental health services needing to go up, shelter services needing to go up, abortion services going up, adoption. Somebody talked about earlier. Do you think this is going to increase instances of child abuse? Like, there's
And
just so much.
another thing you can do, like if you're feeling really frustrated right now, get involved. You can write your state representatives.
Absolutely.
Obviously, if you are in one of the states where it's being banned or has been strict, find um, a group, a support group, or an activist group that is trying to push for change. Or a lot of the times, even if you're going to be in one of those states where it's banned, they're going to give you resources on how to navigate those processes for you if you need that
Yeah,
abortion or if you need that care. Um, it's, I worry that organizations like Planned Parenthood are going to be completely pushed out of those states um,
that's the. I mean,
over
that's the
time. And
goal.
that's sickening because a lot of us, a lot of humans don't have health insurance right now.
No,
And the problem is that when you have, like, through college, Planned Parenthood was my go to for those services because I didn't have health insurance.
right.
You
You're
know,
going
like,
in to get your routine
get your stuff
gynecological
done.
care, getting
Routine care,
access to
man.
birth control, getting access to pap smears,
Yes.
cancer screenings,
The
the whole
basics that
nine.
a lot, your primary care doctor can do some of that, but a lot of the times these
Absolutely.
people are going to send you off to a specialist or an OBGYN
Absolutely.
place. And a lot of us don't have PCPs because I don't health insurance.
There's health
Yeah.
insurance. I mean, I'm in that category right now. In
Yeah.
between jobs has meant in between health insurance. So yeah, I would be sad to see more of these services be reduced, more access to care be reduced, and then especially when it comes to the mental health surgeons of just anxiety, depression, or burnout for healthcare employees specifically, because we're front line, right? We are the front line of this particular experience. And I mean, while it's going to impact employees, because in some states, with these being banned, the employers might not be able to provide these services to you via your insurance. So there's just so many different ways that this could be like, smack, this is in your face today. Um,
Absolutely.
One thing I do want to offer though is self care routine tips, just because it is a lot of stress right now. And it's especially when we do feel triggered or we do feel an influx in I won't say negative emotions, but somewhat debilitating emotions. It can become a struggle. So
Yeah.
some of the things that you guys can do if you're at work is make sure you take your breaks. Make sure that you're eating sensibly. Like, try not to go into the stress snacking. If you do, try to pick things that are like whole and wholesome. Maybe not the whole bag of Doritos. Maybe, no
Go
judgment
for some
though.
cheese, nuts, something with
But
some
some,
protein in it.
yes, some yogurt, some oatmeal, different things like that. You can do a quick Google search. But I often find keeping those things on hand help me in moments like this, because in moments like this, I don't have the energy to try to go to grocery store or try to do the good things. So preparedness helps. If you can, try to get adequate sleep. If you are on a regular exercise routine, do your best to maintain it. Can really help keep you level and focused. And I always suggest anything that you can do outside, even if it's just sitting outside for your break. Of course, change your scrubs, but just to help you decompress and relax. All right, and then as far as work, I know it's very difficult in the operating room space to decrease your workload, but you can increase your conversation with colleagues. Like Rebecca said, they took the time to really talk to each other this morning, where we might have just thrown our scrubs and get on the floor. Um, Oftentimes, the hospitals will have different professional support groups or access to, so those are some options as well. And then employee assistance program. I like to talk about that when it's anonymous. You can reach out to them and talk to them about your stress management needs. All right. So we are going to get ready to wrap this up. We hadn't planned on going live today, but this news was just too incredibly important for us to let it lapse here with y'all. So the Process Network decided to come out of retirement for a little bit to bring y'all this content. We will be returning with season 2 of shows in August. Behind the Red Line will actually kick off the season 2 experience for the Process Network on 8/8/2022. The process itself will come back 8/10/22, And lastly, we'll be premiering the autobiographical podcast Voices on 8/14. So a few things to look out for there. Lastly, I'll say we will be in Vegas July 16th and 17th. If y'all are interested in linking up, we will be on site at CCSA's 36th annual conference in the sterile processing space. Hey, Ofui, I heard you speaking, right? You're talking about you hold on, like let me go grab that because I don't want to say the title of yours wrong. And I thought it was really interesting because it was a topic I don't see all the time. So I'm actually gonna go grab it.
Yeah, I can't remember what it is. There's
And I
some
don't
good
want to.
topics going on that
I don't want to
for
butcher
that.
title. I was really surprised. Not CCSA usually puts on a really good conference every year, but the I was surprised by the diversity in some of the topics this year. So Ofui is speaking. His topic is how to get staff involved with the processes of the department. Um, Sarah B. Cruz will be there, Damian Berg, Marjorie Wall, Dolores O'Connell. So some familiar names and then some new names gracing the stage. This will take
Sharon Rojo, I think, is going to be
yep,
there.
Sharon's there, Michelle McKinley. There's quite a few. 2 days of conference happening over a weekend, Saturday, Friday, Saturday, Sunday, with CCSA in Vegas. So today's actually the last day to book the hotel room discount if anybody is interested in going. And then tickets are $100 for members and $125 for non-members if you're planning on going. Leslie Constance says, thank you both. Wonderful episode. I appreciate it. Appreciate it.
Thank you.
Angie, staff engagement is so important. Absolutely. Absolutely. Couldn't agree more. Rebecca, any parting words you want to share with folks before we wrap up? We won't be seeing them again until August.
Just
Yeah.
stay strong, and keep your best foot forward. Keep fighting, and try to it when you're coming into work and having this weigh on your mind. Um, Try to find your focus point. And one thing is that when these events are happening in the world, it's hard to focus on your trays. It's hard to focus on our daily tasks and sterile processing, and a lot of the times it's so impactful that we're making it's easier for us to make a mistake. So find your outlet to vent your emotions. If it's too much, take a break, write it all out, record yourself on your phone, go outside, take a break, but
Really,
make
please.
sure that you are if you are working in sterile processing and you are disturbed by the events going on in the world, that you are able to check it to another part of your brain while you're at work and keep your focus, because we still have the patients every day that we need to make sure we're doing our best work for. um,
Absolutely. They're counting on us. If you find that it is too emotional, it's too overwhelming for you to be able to focus and commit to that. Service excellence, know yourself, take the break, step off the floor. If you need to go into a meditation room, if you need to
yes,
take a day off, whatever it may look like for you, prioritize your self care because at the end of the day, you guys need that body, that mind to in order to execute, right? So we want to make sure that you stay resourced. And even though this is an extraordinary time and it makes us want to stretch ourselves and do more, um, I don't want us to, look, just take it easy, guys.
take it easy, reach
Take it.
out to your employee assistance plan.
Yes, they are there if you need them.
All right.
All right. So you can find this episode and past episodes of the Behind the Red Line podcast on LinkedIn, Facebook, and YouTube. Anywhere that the Process Network episodes air. Be sure to like this channel if you're following us on YouTube. If you find this helpful, please do share it. You will be able to catch this show every other Monday starting back in August on the 8th. We will be having content for you guys. And until then, stay safe. Take those look, I'm just keep saying take those breaks.
Yeah.
We will, as a healthcare community, we will get through this like we get through every little crisis they throw our way.
Just keep up the fight.
All right. We'll see you next time on Behind the Red Line. Have a good night, guys.
Good night, everyone.